Right now, there are new recommendations for mammograms. A national health panel says start getting them 10 years sooner, and hopefully this will save a lot of lives. Jennifer, break this one down for us, please. I think we're a little confused because we've heard that the guidance is 40, and now we have this other health panel out saying the same thing that we have been told for years now.
Exactly. In fact, the advocates that I spoke with said this task force is a little behind the times. They say early screening is known to to be a health preventative measure. And in fact, they say that it should be done annually. The task force is saying biannually. So again, they are saying to get mammograms once a year. The U.S. Preventive Task Force releasing new recommendations for women to start screening for breast cancer starting at age 40. Susan Brown says the Susan G. Komen Foundation has long advocated for this and hopes it clears up any confusion.
If breast cancer is present, finding it early leads to better outcomes. It's likely to mean easier treatment for patients and also for lower costs for treatment.
The president of the Pennsylvania Breast Cancer Coalition says the state passed the Early Screening Act nearly 2 decades ago for women starting at age 40 annually. The new recommendations from the task force are recommending screenings every other year.
We think that the task force is a little behind the times. That gives 2 years for cancer to grow if it's in the woman. And that's too long a period of time.
In the new draft recommendation, the task force urgently calls for more research on how to address health disparities, noting Black women are 40% more likely to die than white women.
We don't understand all the reasons, but part of the reason may be that younger women and Black women may be diagnosed with a type of breast cancer called triple negative breast cancer, which in overall is a more aggressive disease and tends to spread or metastasize early.
Just last week, Governor Shapiro signed a new bill called Act 1 that allows women at high risk to get MRIs and genetic testing at no cost. Pat Halpin-Murphy says the task force is behind again, instead calling for more research and evidence in using the latest screening technologies.
The task force hasn't recognized that MRIs are the latest in effective screening for women at high risk. And the science is there.
The task force says this is a draft recommendation, but after a commenting period, it is expected to get approved. Sheba and Jason.
All right, Jennifer Lee, thank you very much.